Good afternoon, viewers, and welcome to yet another live session. Today, we are back with an interesting topic, which you should all be well aware of, which is breast cancer, the early detection, signs that you need to recognize. Joining us today on our live session, we have Dr. Shamna Mahmood, Consultant General and Laparoscopic Surgeon, Specialist Hospital, Bangalore. Welcome, Dr. Shamna. We would like to start off with elaborating a bit on the signs and symptoms of breast cancer.
Good afternoon, everyone. Signs and symptoms of these, as most of you know, most common symptom that patients come to us with breast cancer is a painless lump. So it can be any lump, it can be of any sizes. You have to remember, it is not only seen in the breast, it can also be in the armpit, because a part of the breast is also there in the armpit. Other symptoms involve the nipples. If there is any destruction of the nipple, any changes in the nipple, any retracted nipple. Now some women already have retracted nipples. I'm not talking about them. If you had normal nipples and then it gets retracted recently, there might be an underlying malignancy. Destruction of the nipple, any bleeding through the nipple also might be because of underlying cancer. Any changes in the skin color, redness, or even smile. It can sometimes, an underlying cancer can present as a mild dimpling of the skin or any puckering of the skin. Pudy orange skin appearance is an orange peel appearance of the skin. It's not colored like an orange, but you know the typical orange appearance of that multiple pits and little thickened edematous look, your skin will appear like that. In that case, you have to immediately meet your doctor. It can also come as an ulcer on the breast, and sometimes patients, this is usually seen in older women who doesn't tell others they're having a lump in the breast. They can come to you with symptoms of the metastatic disease like fracture of the spine, or they might come with pain in the bones, jaundice, etc. So any older relative in your family or someone tells you that you're having a lot of bone pain, they're coming with jaundice, any breathlessness, it can be because of an underlying breast malignancy.
Thank you, doctor. Who can get breast cancer and which age group is at high risk?
Usually saying anyone with breast tissue can develop breast cancer, but it is most commonly seen in women. 99% of breast cancer patients are women. Telling that we have less than 1% of breast cancer patients who are men. Men do have breast tissue, it is just not functional, and most of the men who come with breast cancers are in advanced stages. Why I'm telling this is because even men, if they feel a node in the breast, they should come and meet your doctor. In age group, usually it is a disease of older age. It is very rare to see breast cancer in people less than 20 years of age. More commonly, it is seen after 40. As your age increases, the risk of breast cancer also increases. Majority of breast cancer patients are between 40 and 60.
Thank you, doctor. You mentioned the age group for the people who will be at high risk. What are the risk factors?
As such, I told you, your female itself is a risk factor because more than 99% of breast cancer patients are women. Age, as I've already told, as your age increases, the risk of breast cancer also increases. Other is like personal history. Like if you had breast cancer once in your life, then you are always having a higher chance of developing breast cancer in the same breast or the other breast. Any family history of breast cancer, like anyone in your family, especially first degree female relatives, your mother, your sister, your daughter has breast cancer, you also have an increased risk of breast cancer. Any history of benign breast diseases like fibrocystic disease, LCIS, that is lobular carcinoma in situ, etc., you have a higher risk of breast cancer. Hormone replacement therapy. Women postmenopausal women who take hormone replacement therapy has a higher risk of breast cancer. Early menarche, like if you had your first periods before 12 years of age, that is a risk factor. Late menopause. Nulliparous women, that is women who have not had kids, have an increased risk. Women who have not breastfed their kids also has a higher risk of breast cancer. Another thing we talk about genetic mutation. Sometimes some families have certain mutations in their chromosomes which predispose them to higher risk of breast cancer, most commonly like BRCA1, BRCA2 mutations. These, if you have multiple breast cancers in the family, and if they are having breast cancers at a younger age, that is less than 40 years, your doctors might ask you to do some blood tests to look for these mutations. Even urban lifestyle itself is a risk. Sedentary lifestyle, we have found that breast cancer is more in women with a sedentary lifestyle. Obesity, especially if you gain weight post menopause, alcohol, increased intake of alcohol, smoking, all of these are risk factors. And sometimes when you're a kid, you had some malignancy and you have a history of chest irradiation before 20 years of age, you also have a high or increased risk of breast cancer.
Are there ways to prevent the disease?
Because there is no particular causative factor for breast cancer, we can only have, we don't have any vaccination, or there's no particular cause which if you avoid, you will not develop breast cancer. But definitely there are ways to reduce the risk of developing breast cancer. Like I told you, already this screening. If you screen, or if you follow the screening methods available, we might be able to pick you up before your cancers develop into an invasive disease, and we can treat it and prevent you from developing invasive breast cancers. And there are other factors like lifestyle changes, improved diet, reducing weight, avoiding hormone replacement therapy, no smoking, limited intake of alcohol. All these will help in reducing the risk of breast cancer. And like I told you, avoiding hormone replacement therapy, that I've already told you about it. Breastfeeding protects against breast cancer. Now, in high-risk women, this is for women with average risk of breast cancer. There are high-risk patients, that is, like I told you, who have multiple breast cancers in their family, who is of younger age group, or who is from BRCA families, that breast cancer mutation gene is there already in their family. For them, we provide something called chemo prevention, in which they are given hormones which reduces the breast cancer risk, like tamoxifen. How it helps is, and these are not completely safe drugs. There are risk of clots, bleeding, etc. That is why we are not giving them to other women. We are only giving it to high-risk women. And other option we give for these women is prophylactic mastectomy, in which we remove the breast before it develops breast cancer. After that, we can give them breast reconstruction.
Thank you, doctor. One of the most important ways to prevent disease is screening, you mentioned. What are the screening methods for breast cancer?
We have 3 methods. One is self-breast examination, then annual breast examination, and then mammography. Self-breast examination is advisable for all women after 30. That is, basically you have to examine yourself, know your breast, so that if there is any new changes in the breast, you will know, and you will know when to go to the doctor. See, screening methods is usually done for patients who does not have symptoms. Our idea of screening method is so that completely asymptomatic women should do this, so that we will be able to pick up the disease before it presents itself. So self-breast examination is advised every month. Best time is 5 to 6 days after your period start. That time your breast is smaller, so it is easier to pick up changes. We tell these women to stand in front of the mirror, examine by standing, sitting, and then lying down. You should examine your left breast with your right hand, examine both the breast and the armpit, and the right breast and the right armpit with your left hand. You should examine with the flat of your fingers, not the palm. And when you are examining, initially it is superficial examination, then deep, then you press the breast against the chest and feel, and lastly you should not miss the armpit. This examination is done in a circular motion, so you don't miss any areas. You should always feel behind the nipple too. This is another area you might miss. And once you feel any changes, then you can go to the doctor. The next thing is annual breast examination. Annual breast examination is examination done every year by a physician, a doctor. Most women prefer to go to their gynecologist or your surgeon. It is advised after 40 years of age. So every year you can go to your doctor and get yourself examined. Now, if you want to do annual breast exam or breast examination before 40 years, it is not usually advised to do it every year. Every 2 to 3 years you can examine if you want. Along with this annual breast examination comes mammogram. So mammogram is a low radiation X-ray of the breast. There are particular lesions and findings that can be picked up in mammogram, which will tell us, which is indicative of cancer. And mammogram might pick up the disease before the lump forms itself. This is advised to do every year after 40 years till you're 60. It is not seen to show a big change in treatment after 60. Mammogram, important thing is it has to be done every year. There's no meaning in doing it every 5 years once and then you forget about it. It doesn't help, because it has been proven for women who do mammogram every year after 40, we are able to pick up the disease earlier and they can be treated with less aggressive treatment. That is the important thing. This now people who do mammogram might know it's a little painful because your breast is compressed between plates, but nowadays we have 3D mammogram, digital mammogram, which is less painful and equally helpful.
Thank you, doctor. That was very elaborate and helpful for our viewers. Once screening methods are done, how do you diagnose a patient with breast cancer?
See, diagnosis is always with histopathology, because if whatever your tests, your x-rays and mammogram show, histopathology, only if it comes as cancer in a histopathological examination, we can start the treatment. So what we do is, there are 3 steps. One is, first of all, you do an FNAC. FNAC is a very simple test. It is not painful. They just pass a needle through the lesion or the lump. And this is, if it is not palpable, if you are not able to feel the lump, it can be done under ultrasound guidance also. So they will pass a needle, a few cells are taken and then checked for cancer cells. These reports are available within a day or the next day it will be available, and 95% of the cases you will be able to pick up. They will be able to diagnose it as cancer or not. Now if it is inconclusive, then we will go for the next investigation. This FNAC will only tell us whether it is cancer or not. It will not give us any more information. So that's why we go for true cut biopsy. True cut biopsy is also a OPD procedure. It is done under local anesthesia. A small tissue of the lesion is taken out and sent for testing. And once it is done, usually it might take a week at least for the results. We will know more information: what type of cancer, how aggressive it is, what receptors are expressed, what chemotherapy agents can we use. All this we will get from this true cut biopsy. Very rarely I find, especially in sometimes there are multiple types of breast cancers. Very rare cancers are there. In this, FNAC or true cut biopsy might not pick up. In that case, we go for an excision biopsy, in which the whole lesion is removed under anesthesia and then sent for testing.
Thank you, doctor. What are the stages of breast cancer once diagnosed?
Yes, staging is usually done from radiological investigation and also from after resection. This resection specimen is sent for study. There are very multiple methods. Usually we are using TNM staging. It is very complex. I don't think it is necessary now in this platform to explain all this. But simply if I tell you, just for understanding, you can understand there is 4 stages. Stage 1, 2, 3, 4. And if I go for a very simplified version, stage 1 is very early breast cancer, where there is very small lump, less than 2 centimeter in size, or it's not even felt, like you are seeing only in the x-ray. It's not there on clinically, and there is no disease in the axilla. It's just in the breast. Stage 2 is, there is a lump which is more than 2 centimeter in size, and there is also disease in the armpit, but that is also very less. There might be 3-4 nodes and it is not spread out from there. Now stage 3 is locally advanced cancer, like the lump has involved the skin. Like I told you, this orange peel appearance, that is of the skin, that is usually stage 3. Or there is ulcer on the breast, or it is fixed to the chest, the muscles are involved. Even this axillary disease, if it has involved this multiple nodes, like there's large axilla, the patient can feel the lumps. More than 4 nodes are involved. It is surrounding fat, or it is involving the nerves in the axilla. That is locally advanced breast cancer. Lastly, we have stage 4. It is metastatic breast cancer, where it is involved lungs, liver, bones, etc. Why staging is so important is because we treat the patient depending on the stage, and prognosis depends on the stage. When you're talking about prognosis of breast cancer, it is we always talk in terms of 5-year survival rate. How patient will be in the next 5 years? Will they be disease free and will they survive? 5-year survival rate is 100% when you diagnose it at stage 1. Stage 2 also it is very good, it's almost 80 to 90%. But when you go for stage 3, it reduces drastically to 50 to 60%, and stage 4 is only 20%.
Thank you, Doctor. You made it very simple and easy for our viewers to understand this complex process of staging. Once they are diagnosed and staged, is this disease curable?
Like I told you, yes, that is why we are going for screening methods. If you are screened to just diagnose a disease, we will not do it. We have a treatment available. See, once, and this definitely depends on the stage. If it is detected early, it can be completely treated. It is, even when it is diagnosed later, there is treatment to at least increase or prolong life. We have to control disease. All this is possible. It wasn't the death sentence as it was before. Initially, see, even now the largest cause of death due to cancer in women is because of breast cancer. But over the years, actually the death due to, even though incidence of breast cancer has been increasing because of better detection techniques and lifestyle and all, but death due to breast cancer is reducing. That is because it is treatable.
Since you mentioned it is a curable disease, that is a ray of hope. What are the treatment options available?
See, breast cancer treatment is highly individualized. Like, it depends upon the person, her age, her stage of disease, what is a person's expectation from the disease. And like I told you, a lot of findings in the histopathology, what receptors are expressed, how aggressive it is, and it's a combined treatment, and it is also decided by number of people. It's not only a surgeon, it's your medical oncologist, your radiation oncologist, all of them will be involved in planning a treatment protocol. So there are 4 types of treatment, and we'll be using combined, and we'll be using when to do what depends upon the patient. So first of all, surgery. The gold standard is MRM, that is modified radical mastectomy, in which the whole breast and the tissue in the axilla is removed. Even now, this is the most commonly done procedure. But there are, as time goes and as other therapy we have more hormone therapy, we have radiation therapy. So there is newer method. If the tumor is quite small in size and if it's not very aggressive, we have breast conservative therapies, in which only the tumor is removed and we can actually conserve the breast. We have also sentinel lymph node biopsies, in which we don't, because when you're removing this axillary dissection, it is called, when you're removing the armpit, all the tissue in the armpit, the morbidity after surgery is a lot. Patient's movement of the hand is affected, they'll have constant pain, all this is there. So we have methods in which we only remove those nodes that is draining the tumor. So only these nodes are cherry picked and removed. So these options are also there. Then it's not part of the treatment, but it is part of the rehabilitation. We have breast reconstruction surgeries, in which we can reconstruct the breast after the removal. There is breast implants, we can use abdominal muscle to create a new breast. This can be done immediately during the primary surgery if necessary, or it can be done later. Once complete treatment is over, after a year or so, we can plan for breast reconstruction. Then see, the surgeries are basically to remove the local disease, right? We have systemic disease, because breast cancer is actually a systemic disease. That is why it is spreading to the liver, lung. Even though your staging doesn't show that the tumor has not spread to any other parts, there will be breast cancer cells rotating or moving in your blood and lymph. So to destroy them, we do chemotherapy. This chemotherapy is to destroy the cancer cells in the whole body. So that is, we go for chemotherapy. Because if you just operate, remove the tumor, and you wait, after a year or two, patient is going to come back to you with disease in the liver and all. So it is necessary that after the surgery, you undergo chemotherapy. Radiation is to prevent local recurrence. Sometimes it's not done for everyone. Sometimes the tumor is advanced or very large. Even if you remove the whole breast, there will be disease or cancer cells still present in the breast bed or in the axilla. To destroy them, we give radiation. Radiation is also given for breast conserving surgeries, when we just remove the lump. Rest of the breast is left behind, so we irradiate that area. Hormone therapy is given in certain patients who have, they are called basically in histopathology they'll show ER/PR positive cells. In these patients, hormone therapy helps. It is given for at least 5 years after. This is to prevent recurrence of the disease. There are newer agents possible, because biggest problem with chemotherapy is it not only destroys the cancer cells, it can also damage normal cells. So now newer agents are there which are targeted therapy, which only destroy the cancer cells. So they act against certain receptors that is present on the cancer cells. These are less toxic and more effective, and more of these drugs are being found, being discovered, and they are being used. Actually, our consultants are using these drugs now.
Thank you, doctor. Once treated, is there a possibility of recurrence?
See, like I told you, one of the risk factors is a personal history of breast cancer. So once you have breast cancer, definitely the chance of breast cancer recurring increases. So all these other therapies like chemotherapy, hormone therapy is basically to treat the recurrence. And that's why follow-up is also very important. Once you have breast cancer, you have to have continuous follow-up with your doctor, so that these recurrences can be picked up early and treated if present.
The follow-up you mentioned is an important factor to prevent recurrence. So how many follow-ups, or how should the patient follow up with their physician?
So once surgery is done and then chemotherapy is given, chemotherapy can be sometimes given before and after surgery. Sometimes it is just given after surgery, depending upon the stage. So once that is done, and once if radiation necessary it is given, then once the treatment is complete, usually it might take a year or so, then we go for follow-up. So follow-up is initially it is every 3 months. So it is basically very simple tests and clinical examination. Simple tests are basically mammogram, x-rays, ultrasound. There's no further investigations. Only if any of these, something we pick up in any of these tests, we'll go for further investigation. Initially it is every 3 months, and then if the patient seems okay during that time period, we go for every 6 months, and later every year. This is for a period of 5 years. 5 years there is no problem, you are considered cancer free. Then you go back to normal screening, like every year annual breast examination and a mammogram.
Okay. So what is the prognosis of this disease?
Like I said, prognosis, again I'm repeating it, I think it depends upon the staging. Like if you are detected early, again I am emphasizing on screening, because screening is the only method by which we can detect it early. Once it is detected early, you are presenting in early stages, your chance of recovery is very good. Like stage 1 and 2, you have above 90% chance of recovery completely treatment. But when you go for stage 3 and 4, it drastically reduces. But we have found that because we are having better chemotherapy agents and newer drugs are there, even advanced diseases, we have seen even patients with metastatic breast cancer with chemotherapy and palliative chemotherapy, it's called, in which we are trying to we are not completely treating the breast cancer, but we are actually trying to control it, and we have patients are living with disease but on treatment. So it was not the death sentence like it was before. We have lot of survivors of breast cancer, lot of people who are on follow-up and more than 5 years, and they are living normal life. One problem, most of our patients with breast cancers actually are above 40, so they have already completed their family and all. But when they come in earlier, before 40, and they wanted to have kids, one problem with most of these chemotherapy agents is because basically it's a hormone based disease, is ovarian failure, so they might develop infertility. For these women who wants to have kids after the treatment, we have options like we take the eggs before the treatment starts and freeze it and keep, and they can plan pregnancy later. And so it's not an ending, there are different methods. Even another one thing about when you do, I told you before, when you do cancer surgeries, it's a disfiguring surgery, a breast is removed. So for a woman it might affect her confidence and her feeling of self-worth a lot. So for them we have very good breast reconstruction surgeries. You don't have to, sometimes we use their abdominal muscles, back muscles, etc. to reconstruct the breast. If you don't want to go for further surgeries, there is simple implants which we can keep, which is as good as a breast. and they can live normally after that.
That is very reassuring for all our viewers and for us to be aware of prognosis and the options that one could choose. What would be your takeaway message for breast cancer detection and prevention?
Takeaway message is basically screening, because I do see a lot of people who come, they get mammogram, and then very few patients do it yearly like we advise. So when they feel some lump, they might come and do a mammogram, or they come for some other disease, they come and do. Or then there is, there are always camps happening all around, especially in Bangalore, multiple hospitals. So that time they might do a mammogram. See, if you're doing mammogram as part of screening, you have to do it every year. There's no use if you're not doing that, because we want to pick up the disease before it becomes a lump, right? So from the age of 40, do it every year. Only then it is helpful. Until 60, after that no need. And before 40, if you want to give nowadays, if you want to get yourself, especially if you're having family history of breast cancer, sometimes some women come by the age of 35. For them, we have sonomammogram, in which it's just ultrasound. So if you're doing it, do it diligently. And and you should also know what you expect from breast mammogram. It is not 100% effective. It might still miss. That also you have to be aware of. Another one thing, because of this COVID situations, what I have to say is that recently, after the second wave, I have seen a lot of breast cancer patients coming in stage 3 and stage 4. And all of them had felt the lump or knew that they had something at least 5 to 6 months back. They didn't come because they were afraid of the pandemic. See, now what I have to say is that for our surgeons, there is some, we have international guidelines during pandemics to prioritize the surgeries. Like some surgeries, in spite of COVID wave, we have to do it within 24 hours to save the patient. Some surgeries, 3 days, some in a week, some in a month. Some surgeries, they say we can delay it after 3 months or 6 months, we can wait. So breast cancer and its group comes within a month. So once you diagnose, even if there's a pandemic, we should start treatment at least within a month. One thing I want to tell the patients is these COVID cases are coming in waves, and these high peaks are coming, will be over a period of 2 weeks when the hospitals are overwhelmed with the COVID patients. So even if you find you have a lump and you're afraid to come to the hospital, 1 or 2 weeks you can get delayed. 3 weeks, 4 weeks is fine, but months is very dangerous. So you are trying to protect yourself from COVID, but you should not die of breast cancer. And now in Bangalore and all, we have a lot of online consultations available. So if you have a lump, COVID should not stop you from getting a consultation. And you can always speak to the hospital and they can ask them, is it safe to come during that time? There are always surgical parts, surgical wards and OPDs separate from COVID patients, so that you will not be exposed to COVID cases. So if you are having, this is something that younger people have to see about your older patients at home too. So if you feel something, if there is a lump, try to get in touch. Few weeks, okay, but most of the time within a few weeks that COVID peaks will be over, and then you can meet. Okay, because take care and please don't delay. Especially currently, when especially in a place like here, when all treatment is available, you should not miss it. Thank you.
Thank you, Dr. Shamna. That is very enlightening, encouraging, and as you mentioned, screening and early detection is very important for treatment and cure of breast cancer. Thank you, viewers, for joining us today. We will be back soon with another interesting topic. Until then, take care and stay safe.